I'm a military retiree, and so eventually I was medically retired. One of the specific issues was multiple herniated discs in my spine, a lot of damage, arthritis in the spine. That got really compounded in a vehicle accident. It was a multiple rollover, rolled about 7 times in a vehicle. I was seatbelted in, so I'm here. That's the good part. The bad part is seatbelts like to get that T12 area. And I had a compression disc fracture that was not stable at the time. And so with chronic pain for, over 6-7 years of my lower back, was really limiting my mobility. Was a physically active person. And I enjoy that, especially, dealing with PTSD, things like that I have from the military. Physical activity is number one to combat depression, anxiety, and that was being kind of taken away from me by the injuries to my back, lower back. We got to the point where there were no options. We tried some injections to try to combat the pain, doing some spinal injections, some trigger point injections, but there was never a plan to go further. But I will say 3 different health systems in 3 different states worked with this situation. The one who fixed it was Dr. Jimenez, who had a plan and executed the plan.
Brent, he had a catastrophic injury, but we were able to interview him, examine him, discuss with him the findings of a previous procedure that did not render full treatment of his problem, and then eventually a complex interdisciplinary approach where I required an access surgeon to get me to the area of the spine, do the reconstruction, literally remove a vertebrae and replace it, and then reconstruct the spine with all the minimally invasive techniques that we have here at Riverside, where we straighten him out, so to speak, as far as the injury that he had to his spine.
It was a hard recovery. Because of my PTSD and different things, I was very hard on my nurses and taking care of me at times. Coming out of that anesthesia and things, it was difficult for me. And we were close enough, though, here's the key, we were close enough to where I lived that my friends, family, those that love and care about me could come down here to the hospital and help in that recovery, that understood me and work with the nurses and the PTSD aspect, explain things that helped tremendously.
At Riverside, we always try to keep people in the community. So we recruit very good physicians and very hard to get specialties sometimes. And back in the early 2000s, we didn't have any neurosurgery at Riverside. So we made a concerted effort to say, that's not acceptable. We're going to bring neurosurgery to our own community.
We've been in practice for 18 years continuously. However, in 2024, we have full-time, 24/7 neurosurgical coverage. So that allows us to attend to all of our patients in the community, emergencies, consultations, injuries. We're able to do it 24/7. I think that's the very exciting piece in our practice that is remarkable. The other part is our technological adaptation and innovation. The technology component in our practice has been one of the things I've been very grateful to the organization since the inception of our practice, right? It took an investment to start, maintain, and develop and expand a neurosurgical program. One of the areas of discussion when I started practicing here at Riverside was interventional procedures for the brain and spine through catheter-based techniques. My partner, Dr. Zakaria, is getting advanced training, fellowship training at the University of Chicago, and that technique or techniques require specialized equipment.
All of this work is actually X-ray based, so we simply have catheters and wires that we can see on X-ray. We tunnel these through the system, through the arteries and the veins, and we can see them continuously on X-ray, and being able to acquire images that are in 3D and sometimes even more advanced processing techniques for this, just to be able to deliver perfect, efficient, quick, and safe treatment to these relatively complex and delicate structures in the brain.
Riverside has been blessed to be in a community that has a lot of people who give for these sorts of services from a philanthropic standpoint. We have a great cancer program. We have a great heart program. We have a great neurosurgery program. We've got a great orthopedic program. All of those programs were built on philanthropy, on people in the community saying, we need those services here versus sending people to Chicago. And so, again, we have been very fortunate and blessed at Riverside to have a lot of people fully support our programs, our desire to have those programs locally here, and to have great quality programs with great physicians and great technology.
The change, first off, is dramatic. Posture-wise, number one, posture has been improved. It has been affected. Mobility has been directly affected. I can bend, I can lift things, I can get back in the gym set in the garage, and I'm not going to any strongman competitions anytime soon, but I'm lifting weights. The surgery worked, and not just worked, because a lot of people can get you stable. I have had a procedure that's got me mobile, which is more than any gift I could ask for.